I'm Gerry Samson. I am not Lee Boyd. And who are you?
I am Lee Boyd,
And you're not.
Gerry Samson.
Yes.
You can tell by
So
the hair.
Lee and I have a meeting planned for you called Essentials and Beyond. And what do we do during that meeting, Lee?
If you're ready to begin the Invisalign or a clear aligner game, it's kind of your ground zero of getting your feet wet and getting your bases all in order so you know where to start, how to avoid trouble, and to grow and become more confident in what you're doing with your aligners.
Yeah, what we have in mind is an introductory course, but it's really for people who are just getting into this to the point where they're thinking, I need to include this in my practice. But it's also for people that have an would I say an intermediate amount of experience? Is that accurately?
Very accurate because a lot of people that are playing in the pool of clear aligners, uh, they're trying to check it out, but they haven't figured out how to make it profitable and how to get the workflows in their office so they can scale that to be way more efficient and profitable. So we're going to talk about in this essentials class not only how to just get started, but how to incorporate it into a really busy office so you can have work systems and flow that doesn't upset the whole apple cart, mainly your staff.
Yeah, we don't want to. Explain, Lee, how long have you been doing this in your pediatric dental practice?
I've been doing orthodontics since I opened back in 1996, way back in the
Mhm.
1900s, but I've been doing clear aligners with Invisalign since 2012.
So we do focus on comparison between clear aligners and fixed appliances. Clear aligners is Invisalign, but you don't have to use Invisalign. Lee does focus on that because I don't think that there's really much doubt that Invisalign is they're the innovator and they're the leader in the technology behind clear aligners. But whether you want to actually use the Invisalign product or not, that would be your decision. What we focus on is a small boutique hands-on experience. We're quite happy with 30 people, but we are not interested in more than 35 because the experience itself, and it's an experience, it's not just a clinical recipe. No, this is how to see and how to think orthodontically and how to see and how to think orthodontically with clear aligners. Now, Lee is an expert in clear aligners, and I like to admit rather quickly I am not. Even though I'm dual trained in pediatric dentistry and orthodontics, when Invisalign launched, I decided it wasn't something I was interested in. And as I like to explain to people, if you're in dentistry, if you're in dentistry and you don't have a comfort level, and I don't mean clinically, I mean to discuss with patients what is this Invisalign? What is it capable of doing? What is it not capable of doing? And what about the fact that these trays are removable? The patient must cooperate. Right, Lee? What would you say?
Oh, absolutely. Cooperation is the key. But I think what you hit on the experience, that is true. I've thought in my head, experience matters. And for us at our clearly Nathos classes, you will have an experience. It's not just about let's fill your brain full of knowledge. We want you to interact, and the cohesiveness of the group is awesome. We have after after class discussions at night, which is probably as beneficial, if not more, than the class, where everybody can talk about different aspects of what's going on in the practice, uh, problems that aren't going on. But also, when I say experience matters, the experience that your patient has matters in your office on the perception of your office. So when you provide clear aligners, you look like the modern office, and you're providing what we want to have as an enhanced experience for the patients and the parents coming to your office. But also, experience matters for the clinicians because how much experience we have in our hands and how much we learn allows us to provide this treatment more profitably, more successfully, and more importantly, is more confidently in what we're doing.
Up to date clinical technology. Up to date clinical technology. Without that, you know yourself, people watching this, that if you feel that an organization, especially a medical slash dental organization, is not keeping up to date with the technology, that does not inspire confidence. And that is what Lee and I are here to do with this essentials course, is provide a tremendous amount of information about how to see orthodontically, how to see with clear aligners, how to think orthodontically, how to think about clear aligners, and to discover what it is about these systems that you will find incredibly provocative and incredibly useful. Lee, anything else?
I like that. See, think, and do. That's what we want you to be able to do when you leave one of our classes.
And we guarantee you, you will have a blast and learn a tremendous amount. You have our word on that.
The fun for sure.
How you enroll in one of our meetings will be very obvious to you.
That's Thursday, Friday, and Saturday, October 8, 9, and 10, concluding Saturday at noon. Scan the QR code. Why wait till next year? October 8, 9, and 10, 2026 is the final time Lee and I will offer this meeting for this year. You don't want to wait till 2027. Now, scan the code. Go ahead.